Thank you for joining us here at Derma One. Lipedema, our topic today. And thank you even for you as a mental health specialist and patient to share your opinions, to share your experience with us. Thank you that you're coming.
Thank you for having me as well.
Thank you so much. Karima, what was your experience when you were growing up with the not knowing diagnosis lipedema, but what was your experience at teenage time?
Okay, so I think I can go back to the teenager years. I don't think it bothered me much as a child. Not as much as I can remember. As a teenager, I felt that I had this proportion in my body. I always had this feeling of having bigger legs. And I wasn't overweight, but my legs were bigger than the rest of my body. So I kind of knew something was not normal, but I just went through it without obviously any diagnosis, because I think back then also it wasn't as common. And so I grew up, I became a mom, and then I finally got to know about lipedema when my mother was diagnosed with lipedema. And then I started searching about it and searching surgeons that were actually specialized. So it's good to know about lipedema, but you also need the doctor that's going to be specialized in treating it, right? And so I came to Derma One, to Dr. Sadek. It was more for like vein issues. And I was just casually asking him if he knew any therapies for lymphatic massage, because I had read that it was good for lipedema. And as a joke, I said, you don't happen to have a lipedema surgeon? And he said, actually, we do. And the surgeon comes to Bahrain. So, of course, I was very excited because I didn't have to travel abroad to have a surgeon, to have a diagnosis. Obviously, pre-diagnosis, you have the frustration. You know, you're thinking my body is working against me. I was always active. I practiced sport. I even completed 2 Ironman with the lipedema legs, which is, I think, very exceptional, I want to say. And then there was always this frustration, the not understanding what is happening. I've had good diet, I was active, and yet nothing was changing in my body. And so I came to Derma One, and I had my first consultation. And finally, the diagnosis fell. I had lipedema. So I want to say, not as shocked, because I think I was kind of like expecting it, but I was relieved. I think I felt that relief because I was always feeling guilty. You know, maybe I'm not doing enough. Maybe I'm the problem. I'm not eating healthy. I'm not being enough active. Although I was not active, I was hyperactive. And so I had that diagnosis, and it gave me relief. But then what's next? Now we have to plan for surgery. And of course, with surgery comes other emotions. You know, you have the fear, the unknown. What am I going to look like after the surgery? What is the surgery? How am I going to recover from the surgery? Of course, now you start going into all those, you know, accounts and search for people who have gone through it, you know, and you obviously have to now prepare yourself for that important step.
Well, just one thing I'm interested in how you felt with the self-confidence. Tell me about that when you just like did not have the diagnosis of lipedema and how it developed just like during school times, becoming a woman and the self-confident feeling maybe before planning a surgery.
So lipedema doesn't go anywhere, right? So with time, my legs got bigger. And I think with stress, it also aggravated it. Mm-hmm. So I was being active, even more active. I had children, I was a mother, I was working. So I've never stopped being active, and I was training. But my legs kept growing. And I was very frustrated. Obviously, I felt I had very low confidence. Yeah, I couldn't wear what I wanted to wear as well. So I had to buy another size and another size. I had to change my wardrobe completely. And this is one of the reasons that I quickly made up my mind for surgery. Obviously, I have tried the proper, not dieting, but anti-inflammatory diets, everything that you still need while going through all those steps. Even if you go through surgery, one surgery, depending obviously on your case, you might require a second one. That was my case. You still need to take care of your, obviously, nutrition. But even with all that, nothing changed. So I knew that I have done everything that I could prior to surgery. And then surgery was my only solution. There was no others. I have tried the massage. I have tried everything that you can read off. And it didn't make a difference. If anything, maybe I lost 1 or 2 kilos in places I didn't want to lose weight. Definitely not my legs. So I prepared for the first surgery. I had a very good medical team, obviously. I had, and I think that's a very important part, I had a support system. So whether you are diagnosed or deciding to go for surgery, in between surgery, for those who require more than one surgery, you need to have a lymphatic massage, so a specialist, so a therapist. You need to have a dietitian if you're not aware of what, or you don't have the knowledge of what you're supposed to eat as well. And a good medical team. So you have obviously a good surgeon. He has the knowledge, he's aware, and can give you all the information, answer all your questions. And then the team with the doctor, obviously, because they're the one also who are going to be supporting you. So the doctor and the whole medical team, and the mental support as well. So I think that my recovery was easier. It was challenging, but transformative. But it was challenging in terms of pain, obviously, because after the surgery, on the first day after the surgery, you will automatically see your leg shrink, the size of the legs, the transformation, right? But then the next day comes the swelling and the bruises and the pain. And when I mean pain is in terms of mobility, not being able to move as fast as you would like. So depending on the area treated as well, if you want to sit, lay down, everything becomes more challenging. But you do feel free. I felt like lightness. I felt that there was no heaviness in my legs. And then I think that having that mental health support helped me in my recovery. I think half of my recovery was being mentally prepared for what was going to come with the surgeries.
How was your mental fitness or mental health or confidence if you're not limited to what you must wear to cover certain areas of your body, or maybe to wear even skirts or shoes you like?
Well, it obviously changes your life as a woman, yeah? You want to feel free to wear what is it that you want to wear. And even, like you want to go swim with your kids, or, like it's summer, you don't want to be fully covered. And it becomes, and even if you want to be fully covered, right? It's how much more sizes can you buy? Because it really gets bigger and bigger and bigger. And you know better than me, than very late stages of lipedema, it's not just the size of your legs, but the pain that comes with it. I know my mother, for example, who has lipedema at a late stage, but didn't know about all these options, find it very easy to walk as well. So you get affected not only physically, but the way you look, and the way you can dress, but also your movements. It's what you need to do on a daily basis.
I always call this the quality of life. The goal of the surgeries is to improve the quality or give back the quality of life because of the transformation of normal fat cells to pathological one. It's limiting how you move, how far you can walk, what you can dress. You always feel just like, from a medical aspect, the heaviness, the bruising, the swelling, the pain, and it's limiting 24 hours. Yes. So the quality of life is improving. And this is also improving your mental status, your mental health. Tell again, please, just like you had with you, just like 2 surgeries.
Yes.
Okay. Especially, how was the time in between?
So I had my first surgeries last year. My first surgery, it was last year. Obviously, surgery is very straightforward. You wear the compression garments. Then, as I was telling you, starts the swelling and the bruising and the pain, which is more related to mobility. I was prepared mentally for it. I knew that, okay, once the surgery is done, the next 48 hours are going to be the most challenging. So I'm preparing myself for that. Obviously, you have your family surrounding you. You know that you're going to be limited in movement, so you need someone to assist you. The doctor is always ready to answer any questions, because as a doctor, you know what's going to come after the surgery. After a patient, when you're a patient, you don't know. So you're always asking yourself, is this normal? Am I not bruising too much? Why is it that swollen? So it's good to have also a doctor and a medical team ready to answer your question. And I think it really helped me having that part. And then, surprisingly, while recovering, while being challenged, I was also looking forward to my second surgery. And I think that was only made possible because I had a good mental health support. Because if I did not have the mental health support, then I think I would have dreaded the next surgery. I would have felt depressed, because that's what people usually notice. And then I would not have wanted to do another surgery. So I remember, I think 2 weeks after my first surgery, asking already, when can I take the next surgery? And then obviously medical team telling me, why don't you just recover from this one? Let's give it a couple of weeks and we will obviously advise you of the best time in your case.
One of our most asked questions are always just like, how painful is it? Because pain is something patients don't want to feel, don't want to have. And restricting also just like the mental situation.
So how pain, well, pain is relative, right?
Yes.
So it's depending on the person. Now, let me tell you something. I went through 2 surgeries without any painkiller. For medical reason, I cannot take any painkiller. So I obviously had to mention it from the very beginning. After my surgery, no painkiller. And I went through the entire recovery, 2 surgeries, no painkiller. There is pain. I'm not going to lie about that. But you're also prepared for it. And the pain is not, obviously you're bruised, right? And you have stitches for the first week. But I think it was more the mobility. I was very frustrated because I wanted to walk faster. I'm a very active person. So I wanted to walk faster and I felt that I couldn't. And I think it depends what we call pain and our pain tolerance as well. Mm-hmm. I don't think I have a very high pain tolerance and I did it without painkillers. But I prepared myself. I knew the first 48 hours were going to be the most challenging. And then I said, okay, now we survived those 48 hours. And you look at the positive side as well, right? So I'm thinking, okay, I passed 48 hours. There are no complications. So I should also be happy about that, right? And so 48 hours down, then I said, you know what? Now let's see how we can take it to the next week. And if 1 week seems too much, then I take it 1 day at a time. And when 1 day at a time seems too much, then I take it 1 hour at a time. And I'm like, okay, we're going to be okay this hour. And then the next one. And then you just obviously find ways to be more comfortable. And a big factor as well is that I had my first surgery here in Bahrain. So I spent 1 night in the hospital and I went home and I was in my, the comfort of my house. I was back to my routine, which helps because you're kind of like forced to do a little bit more that you would have done if you stayed at the hospital. And my second one was done in the GCC, in the region. So also very good because within a few days I could go back home. It was a bit difficult for me to think of doing the surgery abroad, just because you have to spend weeks outside of your country, and it becomes a bit difficult if you have children, work, and so on and so forth.
Family network.
Yes,
but
exactly.
it helps.
Yes.
One more thing, just like if you think of, okay, you get the diagnosis and they tell you do exercise, do a special diet. It's just like always, I have to, okay, to make it better. What about these things, diet, or still staying on diet and doing exercise, keep on going with that after 2 surgeries now? Because we, as a medical reason, recommend to stay on that, yes. But it's mindfully a little bit changing because it's this gives you a motivation. Can you tell us about this difference, pre and post surgeries?
So I have not been able to train as much as I would like to since my second surgery, but it's been 6 months. And obviously, once you stop exercising, it's difficult to put it back into your routine. So we're in that stage. But I know by already walking that I'm much lighter. My steps are lighter. I don't feel like I have those, dumbbells of 5 or 10 kilo attached to each of my legs. So that was a huge change. Yes, there are, I wouldn't say restriction when it comes to diets. If it's not lipedema, it's another medical condition. You have to take care of your health, and nutrition is one part of it. So you don't have to starve. You just have to make healthier choices. I think there is also a very important factor is the between surgeries. So yes. I knew from the beginning I needed at least 2 surgeries. Obviously, the doctor explained it to me. So you go through one surgery because they cannot treat the entire leg. Obviously, that's my own experience. So it had to be done in 2 surgeries. So you do the lower legs, but then you still have the upper legs that are still, fat, big. So you also have to be patient during that time. It's like a transition period, right? Where you're like, okay, I have started my journey of being lipedema free, but I'm not yet there. So there is also that aspect where you have to be very patient with yourself and understand that this is temporary. Obviously, there is a reason why a doctor would not treat the entire leg. In my case, I don't know about other cases, but in my case, it could not have been done at once for medical reasons and safety, I guess, also. Because you want to be safe while going through this journey as well. You don't want it to be rushed. And I think that also made me realize I chose the right doctor. Yes, I think. Because, it's important also that the doctor is straightforward with you from the beginning, not giving you false, expectation, for example. I think that's very important.
Just like, that is why we call it journey. First, you had a disproportion, just like it develops maybe in the most cases lower legs, then comes upwards to the thighs. So you have the disproportion upper body to lower body. And then you, return the disproportion. You start in most cases with the most painful areas. Could be lower legs, could be around the knees, yes. And the medical reason why we can perform any liters that's possible is the medical condition. Even you see it during surgery, the pump rate goes up, the heart rate goes up. People start to shiver when you take out the fat, and the fat is a protection against cool areas, and in operating rooms it's at a low temperature. So we are kind of medically restricted how much liters it's possible to take out in one surgery. And with lipedema patients, even the higher stages, you have higher liters to take out. This is why we have to break down surgeries. And yes, this is also just like a return of the transformation. And we have to, stay on the path, don't lose it. And that's why we recommend just like first surgery, go for this, second for this. And maybe some patients need a third one or something like that. And it's always starting with the most painful areas, most painful one, because we want to have the relief and the quality of life and the mental help. That's the reason for medical side.
Yeah.
Yes.
I think also now that I can reflect on the past two surgeries and the last year, the most important part was being prepared and having a support system. I think that is what got me through it. So as I told you, having a good therapist for the lymphatic massage, having a dietitian if you're not aware of what to eat and not what to eat, having a good medical team, and you come with an excellent one as well. Because now that you mentioned the theater, I remember being in that theater shivering because it was cold, but also because I was scared, obviously, And I had your amazing assistants and, there to support you. It's like they know what you're feeling, like you can see that they are very understanding. They are not making you feel like you're over-exaggerating, right? So I think that was very important. And it doesn't matter what stage you're in, every stage will come with its own emotions, I want to say. Whether you have the diagnosis, once you get the diagnosis, the pre-surgery, post-surgery, in between surgery, after the second surgery, and more if you have more surgeries, obviously. I think it's also important to know what comes with it. What am I going to feel in that stage? And what support do I need in that stage? And you keep moving, obviously, on different levels in your own journey, I guess, because that's very personal as well.
Who was your most supporter? Who supported you the most during and after surgeries?
Okay, I want to say my family, but it's not the only support that I get. So I don't think it's one support. I think it's a group. It's a support system, right? So you're the one who's going to give you the lymphatic massage. The therapist will be a good support, right? It's before the surgery. And also, if you have any question, I like that he's also aware of lipedema and able to answer some of the questions. Your doctor, obviously, because I think he's the most informed about your case. The team around the doctor, the mental health. I had, obviously, a mental health specialist helping me. I had a colleague helping me. I had my own tools, obviously, and I think that became my lifeline as well. But yeah, definitely the family, because once you get the surgery, I mean, they're the one that you're going to be the most comfortable talking to, right? That's pre-surgery. Post-surgery, they're literally the people who are going to help you get out of bed, get dressed, shower, move around, drive you to appointments. I mean, that's definitely a huge support.
Your mother is suffering from lipedema as well.
Yes.
How is your relationship, or the maybe change of the relationship after two surgeries from your side to your mother?
Well, see, I've always heard my mother saying, I don't understand, I don't eat a lot, I eat good food, and she's really active, but she couldn't understand why her legs kept getting bigger, right? And she didn't understand it until I actually got my diagnosis and explained it to her. Now, because of obviously age and medical condition, it's a bit harder for her to get the surgery, or maybe it's just also that she doesn't feel at the stage that she wants it. But her mobility was definitely is definitely affected. And I think that's definitely one of the reasons I went for surgery. Because I knew that if I wasn't going to get the surgery, then this is what I was going to be looking forward to. Yeah. So yeah, I think that was a big factor. So yeah, I mean, I wish she had known about the lipedema way before and being able to also get the surgery. I'm glad I'm glad she got diagnosed, and that gave me the the beginning of my journey. Yeah, definitely. I didn't know anything about lipedema before that. I have never heard about it.
Lipedema is not obesity. How was this? Yeah, this knowledge that you gained through your own researches. What did it do with your life? Just like knowing from back in the teenage times, school time, just like I'm eating healthy, but I'm growing. But what did it make with you that you got the information? No, I'm suffering not from maybe something obesity, but from lipedema.
Well, as I told you, I think I stopped feeling guilty because I kept blaming myself for not doing more, not eating better, not moving, more than I was already, which I don't think was possible. And also, I had to kind of like forgive myself. Also, there was that, the forgiveness, not knowing better, not understanding what was happening to me. And yeah, the huge relief it gave me, obviously, like finally, I remember seeing the doctor when he, very quick, I think, as a doctor, as a lipedema specialist, one consultation, and within a few minutes, you can definitely know if it's lipedema or someone being overweight. But I think as a person, when you decide to come to the doctor, I think you already know the diagnosis. Yeah, you already know that you have done everything. If you were overweight, then you have already done the exercise part, the nutrition parts, everything that you're supposed to do, and then the weight doesn't come off. So I think once you step in that office, you just want that confirmation. I think you just want to hear the doctor saying, yes, it is lipedema. Yeah. And I remember going into the consultation room, telling the doctor, I am 99% sure that I have lipedema. I need you to give me that one last %. And he's like, well, there you go. You have it. So yeah, it gave me, I think, relief mainly. Yes, I mean it is. I want to say a long journey. It's not, surgery. Yes, it helps a lot. I think it's huge help in the lipedema journey. But it comes with also lifestyle. You have to change. If you have not done so before, you need to change your lifestyle. You need to understand that it's not one surgery, maybe two, maybe it progresses in other areas. So there are all these factors that you have to take into consideration, I guess.
One more question, just like some patients, they feel overwhelmed when we doctors have to tell, okay, you need several surgeries. How was the situation in this second? When a doctor is telling you it cannot be solved in 1 second, it cannot be solved in one surgery, in one treatment, you need a journey, you need several surgeries in your case too. How you felt in this situation?
So I think that I have done my research before. If a doctor had told me you need one surgery, I think I would have run away from the consultation room. That's number one. I was expecting 4 surgeries. According to my own research, I thought I'm at an extreme, stage, like very late stage. So I will need at least 4 surgeries. So I prepared myself for 4 surgeries. And when I came to the doctor, he says, you need 2 surgeries. I'm like, only 2 surgeries? He's like, yeah, in your case, we will do 2 surgeries. We will wait for maybe a year and then see what else needs to be done. Maybe, there's like other areas that needs to be treated. But as you said, as a doctor, you go for the most painful areas, obviously, depending on what your patient report to you. So I was coming for way more surgeries than the doctor actually recommended. So I was happy. I was like, only 2 surgeries? Oh, wow, that's great. Turns out I might need another one, but I think that's one that I want. I think now that I've had 2 surgeries, I feel like there is another area that didn't bother me before because I was more focused on my legs. And now I think I need it on my arm because, we mentioned the heaviness on the legs. But as I mentioned earlier, I completed 2 Ironman, and part of the Ironman is swimming. So imagine having to swim when you have lipedema in your legs and in your arms. I just want to repeat the Ironman, lipedema free. I think that's one goal for me, and see how better I perform. Actually, yes, I think that will be a whole different experience.
Okay, great experience.
Yes, yes. The biking, the swimming, the running. Yes, everything that felt very challenging.
Let me ask you, please, what's your best advice? Your almost one and best advice for our listeners to prepare for the first surgery?
I think it will be more than one advice. The first one is go for a very experienced surgeon, someone that knows about lipedema and experience in terms of also surgeries. My second advice will be to have a support system. So at whatever stage you are in your lipedema journey, make sure you always have a good therapist for lymphatic massage, a dietitian, and mental health support. And my last advice will be trust the journey.
Trust yourself.
Yes.
Thank you so much.
Thank you for having me, doctor.
Thank you.